Hi, my name is Vanessa Moreira, and my presentation is on retinoblastoma. So, retinoblastoma is an eye cancer. It is a genetic mutation in the retina, and this happens when the cells begin to grow and overproduce when usually they're supposed to die. So these cells, they're the overproduction of cells leads to a tumor, and those tumor eventually become retinoblastoma cells. Um, so retinoblastoma is non-genetic heritable, and it is also genetic heritable. Um, the risk is higher in children who's had a congenital form of retinoblastoma. Um, this means like their parents had the congenital form. I apologize. Um, it is heritable, and for those kids who got it because of their genes, it usually results into a bilateral retinoblastoma, which means both eyes are affected. Some environmental and behavior risk factors. So pregnant mothers who have a low diet in fruits and vegetables, um, that can cause their fetus to not develop properly. Also, exposure to chemicals such as diesel and gasoline. Fathers who have been exposed to radiation or just being at an older age can lead to their child to develop retinoblastoma. Um, as for more environmental risk factors, it can include air pollution, sunlight, x-rays, and parent occupation and that's what I found a little interesting, that a parent occupation could actually cause your child to have cancer. And this usually occurs when the parent is exposed to pesticides. Chromosomes. So the chromosome involved, the gene involved, I apologize, is Q14 band of chromosome 13, which is also known as 13q14. RB1 is the gene affected. It is located on the long arm, which is known as Q. Retinoblastoma forms when both copies RB1 are affected by gene mutation. Chromosome, okay. The chromosome for retinoblastoma is dominant. Only one parent has to have a single copy of mutation to pass on the risk of increase to their child. And if a parent has it, 50%, there's a 50% chance that the child will inherit that gene. As you can see here in the pedigree chart, one parent has it and 50% of their children have it. Half of the family is recessive, and others it will show that it is dominant. There are eye models that help assess the risk. The one that I did my research on was Lyman Sharp. It enhances accuracy and accessibility for the doctor. It assists in reading the retinoblastoma scans, which leads to a early diagnosis. With that early diagnosis, treatment could be applied right away, and it could also prompt treatment. Um, it will adjust any treatments, and it will detect any patterns or algorithms that it has seen before. So it is actually a big help. So who is most likely to develop this disease? Infants and very young children. I've done my research, and everywhere it's been saying that the average is the age 2 where they are diagnosed. It's rare for it to occur after the age of 6. 3 out of 4 children who have retinoblastoma, they have unilateral retinoblastoma, which means it's only affected one eye. That is about 60% of the kids. Some children do have both eyes, which is bilateral. So both eyes are affected. Um, 300 children are diagnosed with retinoblastoma in the US per year. Both genders are equally affected. It does not have any preference. And 8,000 new patients annually worldwide are diagnosed with retinoblastoma. Additional statistics. So 40, this was actually very interesting and sad. 49.1% of patients with low income countries had extraocular tumor at the time of diagnosis, compared with 1.5% of patients from high income countries. So this means that the low income is mostly affected and the higher income are barely affected. And I thought that was sad that money does impact your health in a way, because it does impact your environment, where you live, and stuff like that. So I just thought that was very interesting and sad to read. Um, Again, 60% of cases, it's a unilateral. The average diagnosis is 2 years old, and 15% are hereditary. Retinoblastoma, so the organ system it occurs in is the sensory nervous system, and the organ is the eye. The retina is what is affected. So as you can see here, the healthy eye, this is the retina. So this is where light bounces off when you see. This is a healthy one, and the retinoblastoma, you can see here the overproduction of cells that had formed into cancerous cells, and this is where it happens. This is where your retinoblastoma would happen. This is similar to a pedigree chart. As you can see, one parent had a copy of it. And again, 50% of your children will have it dominant, the other 50 is recessive. So as you can see here, um, this child has it, but it's recessive. As for the other child, it is dominant, and this is where they would be most likely diagnosed with retinoblastoma. Some signs of retinoblastoma, and I feel like this has actually become common and more known, especially throughout social media, where your pupil would be white or red instead of black. Um, in photographs, you can normally detect it. This is how your eyes are supposed to look like, and this is what it would look like if you had retinoblastoma. As you can see, the pupil is enlarged and the iris is a different color. Other signs are poor vision, like I said, different colored irises, enlarged pupil, red and painful eye, misaligned eyes looking towards ears or nose, and again, the white or red pupil. Symptoms of retinoblastoma. So there are usually no symptoms, but for those who do experience symptoms, it can include lazy eye, rapid involuntary movement, eye movement, redness, and blurred vision. Untreated retinoblastoma. So if retinoblastoma is left untreated, then the mutated and extra massive cells can spread to other parts of the body, including the brain. So that is very dangerous, because if you leave it untreated, the cells would continue to overproduce. Remember, the cells are not dying, so they're just overproducing, and it could form additional tumors and cancerous cells. It is a fast-growing cancer slash tumor, so that is why you do not want to leave it untreated. So there's a good survival rate. I was very happy to hear this. Um, so it is a 96% of survival rate for children ages between 0 to 14 years. It is 95 to 98% curable, or the cure rate, and it's a 4% death rate. And what I understood online throughout my research, this 4% that passed away was not only due to retinoblastoma, um, they also passed away due to a different disease. For example, like a person didn't die because of retinoblastoma. They died because they had retinoblastoma and kidney disease. So it wasn't exactly the retinoblastoma that caused them to die. But yeah, that is the death rate, just because the people had retinoblastoma as well. Survival rate. Okay. So as you can see here, this is the months of their diagnosis, and this is the survival. So as you can tell, the sooner you diagnose it, the most likely you'll have a cure, disease. The more you wait, the lower your chances become. So that's why it's very important to not leave it untreated. Diagnosis and treatment. Diagnosis. So again, the white pupil when flashed, as we saw earlier, it could also be detected to ultrasound, electroretinogram, MRI of the eye and brain, even a blood test to see if you carry the mutated gene. And you could do this at any time. At any time, you can detect if someone or if a child, if they carry that gene before they even give any signs or symptoms, you can tell if they even have the gene. Treatments can include surgery, radiation therapy, laser therapy, cryotherapy, which is like it's known as freeze therapy. It's very cold. It goes over your head. Um, chemotherapy and artificial eyes. Of course, like anything else in life, there are some side effects. So with surgery, you could lose your vision. You could lose your vision in that eye. Radiation therapy is loss of eyelashes, redness around the eye, damaged retina or optic nerve, and cataracts. With laser therapy, it's eye swelling, detached retina, blind spots, blurred vision, bleeding, eye scarring, and loss of vision. With cryotherapy is vitreous hemorrhage, retina detachment, subretinal fluid, chemotherapy through the vein, or the artery, I apologize. Swelling around the eye, detachment of the retina from the back of the eye, and for artificial eyes, which seems like the less scary in my opinion, is discharge, irritation, infection of the socket. Retinoblastoma. So recurrences are 0 to 23%. Majority of the new tumors develop within 3 years after first diagnosis. For the most part, it's curable. 9 in 10 children with retinoblastoma are cured, which is that 97%. Um, it is considered a chronic disease because it does last over 3 months and it does worsen if it's not treated. Um, yeah. So AI models. So the one I did my research on is Lyme and SHAP. Um, AI can be deployed into regions that doctors are limited to. They can see things that doctors can't, and they can do things that doctors can't. They have algorithms, they're able to observe patterns. So when they detect something that seems unusual, they can alert medical professionals and request if additional investigation is needed. They could determine if the cancer is benign or malignant. Um, they could provide additional diagnostic information or even adjustments to a treatment plan. They could track the development, the tumor size, shape, characteristics, reoccurrence, and evaluate therapy effectiveness. So overall, this does empower doctors to adjust treatment strategies and optimize patient outcomes, and it can help a patient get rid of the cancer sooner than what it would normally take humans. And these are my resources. You guys can take a look. Thank you.